Welcome once again to SoCo Chat, a podcast where we hear directly from county leaders, discuss the latest news, and talk about all things concerning our beautiful corner of California known as Sonoma County.
Welcome back to SoCo Chat. I'm your host, Matt Brown, Deputy Communications Manager for the County of Sonoma. Thank you for joining us. Our topic today is HIV and AIDS, and specifically what the Sonoma County Public Health Division is doing to raise awareness about this communicable disease. Our guest today is Miranda Patrick, a public health nurse who specializes in sexually transmitted infections and who is particularly focused on HIV. But before we get to our interview, I want to start with our trivia question. Our question today is, what is the name of the 1993 HBO movie about the origins of the AIDS epidemic? The movie starred Matthew Modine, Alan Alda, and Richard Gere. If you know, call us at 707-565-2242 or email us at publicaffairs@sonoma-county.org. That's publicaffairs@sonoma-county.org. If you are correct, you'll be entered into our weekly drawing for a chance to win a SoCo Chat coffee mug. And with that, let's get on with our discussion. Welcome, Miranda. Thanks for being here.
Thanks for having me.
Good. Well, I want to start off, just tell us a little bit about yourself. Tell us about your role in public health and why you are so focused on HIV.
Yeah. So as you said, I'm a public health nurse, and of course, DHS is primarily focused on prevention. And so I work both in prevention, we say now as treatment for HIV, because if you're on treatment, you aren't passing HIV, and then also prevention of never getting HIV. So you don't hear much about HIV in the media or anything much anymore, but while numbers have gone down, it's definitely not gone away, and we can get a little more into that as we go on.
Great. Well, I do want to start with sort of defining these terms, right? We have HIV, which is the human immunodeficiency virus, and then AIDS, which is acquired immunodeficiency syndrome. So what are the two what are the differences between the two? And you know, some people use them interchangeably.
Yeah.
Describe those two terms for us.
I'm glad you tackled actually sounding out the acronym.
It's a mouthful. It's a mouthful. Exactly.
So HIV is the virus that causes the infection, and AIDS is technically a stage of HIV. AIDS only happens if you have usually no idea that you have HIV, that you've been infected with HIV. It takes about 5 to 10 years of being without treatment or being diagnosed, that HIV then attacks your immune system, destroys it down to almost nothing, and that's when you have AIDS, when you are at a state where your body can't defend itself from most any bacteria, virus, fungus, things like that.
Right.
So I think that's why the reason people know AIDS and HIV synonymously is because when it was first being diagnosed in the 80s, they didn't know the virus. So they knew the syndrome that was being caused by the virus. And so really people knew the term AIDS really before they even knew HIV.
Right. So we have the virus and then the syndrome that is caused by the virus.
Yes.
Yeah, good. Well, you sort of mentioned it that we don't hear a lot about AIDS anymore. I know people are hyper aware of public health these days, thanks to the pandemic, the COVID-19 pandemic. Everybody knows, you know, what the role of public health and what to do about that. But people are really focused on respiratory viruses, it seems, you know, really since COVID. So you don't hear a lot about HIV anymore. What is the current state of the virus generally?
Yeah. So since you mentioned COVID, the numbers have they were taking a nice decrease. You know, there's a lot of prevention things going on with HIV. And as I mentioned, the medication's very wonderful and good now. And so numbers were decreasing all the way until the pandemic hit us. And then because of a myriad of reasons, I think a lot of it had to do with people losing their jobs and insurance. The numbers are actually on the rise all over the country. And not like a drastic rise, but it's it's not the way we want it to be heading. But the good thing is that there have been so many advancements in medications that now, instead of what used to be in the 90s, handfuls of meds that would make you very sick, they've whittled it down to just one pill once a day that has very few side effects. That's what most people are on these days. And some people even have the option of doing just a shot that's every other month. And the most amazing part of all of this is that the medications are so good at fighting the HIV that it stops it from being able to replicate and harm your body. And it gets to a level of what's called undetectable in your blood. And so if your doctor runs this test to try and find how's the level of HIV in your blood, it will be not detected. And if you're at this undetectable level, then you are actually virtually untransmittable is what we call it. So it's U equals U. Undetectable equals untransmittable. And that means that you can't pass it to your sex partners, even if you were using any prevention, methods, any condoms or something like that. So, and the other way you can get HIV is primarily through, sharing needles. And they haven't been able to do as many studies on the U equals U for this particular subgroup, but they have shown that it is at least somewhat effective at that as well.
Well, that's great news. I know we've come a long way since the early days of this epidemic in the 80s and 90s. So that's great. I do want to talk a little bit more about preventative measures and other treatments, but let's talk about testing, because that's the best way to know your status, right? Originally to know if you have the virus. So who should get tested, and how should one get tested for HIV?
So right now, I would recommend that everyone, and the health department recommends that just everyone get tested. If you don't know if you've had an HIV test, get tested. And a lot of times people think, oh, well, I was at the doctor the other day, or I was admitted to the hospital, I must have been tested. But actually, if you didn't hear that you were being tested for HIV, you likely weren't tested for HIV. I can't tell you how many times people thought they were tested. And especially HIV can be so under the radar. The early stages don't have any, or only the earliest stage has symptoms when you're actually converting to being positive. And then, of course, there's symptoms when you actually are being diagnosed with AIDS. And that's when, the doctors might be privy to actually something going on. But in those in-between stages, which can be years, there's no symptoms. So testing is really the only way. So everyone in ages 13 to 64, especially if you're sexually active, we recommend everyone getting tested. If you have new sexual partners more often, definitely testing more often. Maybe as much as every 3 to 6 months. And we always like a full STD panel that includes syphilis, because that's also back and at it, gonorrhea and chlamydia.
And to get tested, did you say the ways one can get tested?
Oh, yeah. So there are a lot of ways to get tested. Of course, the most accurate way is through a blood draw at your doctor's office. But there's a lot of different ways you can get tested. We in Sonoma County have several free testing options available. It's a quick, rapid test that can be just a finger poke or a swab in your mouth at face-to-face, or DAC, which is Drug and Alcohol Abuse Center. 3rd Street House in Guerneville also does it. And you can usually just walk in and ask at the times that they're offering them. You don't have to make an appointment ahead of time, and you'll have results in 20 minutes.
And it's free?
And those are free.
Wow.
And then there's also, oh my goodness. TakeMeHome.org is what it's called. And right now, California is participating, the Department of Public Health is participating in a trial where anyone can go to TakeMeHome.org and get up to 2 tests, I think every month, that are self-testing. You do the mouth swab, you just rub it on your gums, and then it'll teach you how to read your result.
That's great.
Yeah.
Talking about prevention, so we are sort of know about vaccines, especially with COVID. You know, the vaccine came along, and all of a sudden that gave us immunity to the virus. There's the flu vaccine for the flu. Is there an HIV vaccine? And if not, what are some of the preventative ways or preventions for HIV?
Yeah. So unfortunately, right now, they're still 40 years later looking for a vaccine. You mentioned COVID, and as many people know, there was the new mRNA vaccine during COVID. They're really thinking that could be a promising way to create a vaccine against HIV. So I'm excited and waiting on those trials. But there are a lot of prevention methods. I'd say the best and most effective being a medication that's usually referred to as PrEP. And PrEP comes two ways. You can take it as a daily pill, usually also known as the brand name Truvada. And that daily pill, you take it every day. And if you have a sex partner that has HIV, it's a 99% chance that the medication will block you from any transmission. And then there's also an injection, just like with the treatment, that they formulated one for injection that's also every other month, that's also 99% effective against sexual transmission of HIV. And then, you don't forget the old standby. Condoms are very effective at HIV prevention. And then a mention on, just further going into the PrEP though, is that PrEP only prevents HIV. It doesn't prevent other STIs like chlamydia, gonorrhea, syphilis. And luckily, most insurances do cover PrEP.
Great.
Yeah.
So back to testing. So if someone's tested and they get that positive result, I'm sure that's just an emotional roller coaster and something that they now have to deal with, for the rest of their life.
Yeah.
What are the next steps? What should they do after they've tested positive?
Well, so you're going to want to see an HIV specialist. And I'll go more into detail later, but my team definitely ensures that you are navigated to a specialist. And so we want to get someone into a specialist within 7 days and started on medication. Because what I didn't mention earlier is that even if someone has progressed all the way to AIDS, that there's still a lot of hope in bringing their immune system, building it back up on these medications and still living a long, healthy life. And so we want to stop HIV at its tracks, and that medication can do it extremely fast. Even if you're just taking the pills, it'll just take that virus from these high levels that it's at and whittle it down to nothing in just a matter of, I've seen it in weeks happen, from thousands of copies of the virus to undetectable.
Wow.
And then your doctor will also check your immune system at the first visit, the HIV specialist will, to see where are you? Are you at just the stage of having been infected with HIV? Or has your immune system been destroyed to a level that you would now be considered having AIDS?
Yeah. So what is the role of your team, public health, Sonoma County Public Health Division, in HIV? And if someone tests positive, what do you do? What can you do for people?
Yeah. So as a backup, my team is given anybody who would test for HIV, the hospitals, the doctors, even face-to-face if they're doing rapid tests, they let me know if anyone tests positive, because then my job is to ensure that someone makes it to a provider that their insurance will accept and everything like that, I will make sure that the medications are covered and things like that. There's also a lot of resources in Sonoma County for people living with HIV. And so I can connect them to places like Food for Thought that can help with food, especially like you said, it's such a traumatic time when someone's diagnosed with HIV that, the less you have that's on your plate, the better. Face-to-face also does some housing resources, because there are special housing opportunities, or vouchers, I should say, for people living with HIV. And then another piece that we can take off the patient's plate is actually we can anonymously notify any sexual or needle-sharing partners of their possible exposure to HIV. And we do that not only because that helps that person deal with their own health in that moment, but also, as we discussed, it's such a heavy diagnosis. Having to then talk to somebody who maybe you didn't have the best breakup with is going to be a tough conversation. So we just take that off people's plate and we do it anonymously. So we don't mention them. We don't talk about when they last might have had contact with the person. And then we navigate the partner also to treatment, because about 13 to 15% of people who actually are living with HIV don't even know that they have it. So the partners is so important, because usually a new diagnosis can very well be linked to someone who doesn't know that they have it.
Yeah.
And again, that just brings it all back around to like prevention, because once you know, it's a lot easier to prevent spreading it to other people or prevent getting it yourself.
Absolutely. What about the person who tests negative? Are they free and clear for life, or what should they do if you test negative?
Yeah. So again, prevention. And so I would say to that person, that's wonderful. Today you tested negative. But maybe let's analyze what brought us here today to test. Are these risks ongoing? Do you have multiple partners? Maybe PrEP's an option for you, and I can help navigate you to that. Or maybe, condoms are still fine. Somebody that might be actually in a relationship with somebody who's living with HIV, even with U equals U, being that the person living with HIV could be at an undetectable level, I often like to throw out the idea of the person who is currently testing negative to also be on PrEP, because that way each person is responsible for their own health. And there are things that can throw a little hiccup, in either person's routine of taking their pill or shot and cause, the transmission to happen. And that way, it's not the blame game. Everyone has to be responsible for their own health.
Yeah. Absolutely.
Yeah.
Good. Well, what is the state of HIV here in Sonoma County? How are we doing here?
So as I mentioned, we were, along with the rest of the country, on a downtrend before COVID. We hit our lowest number ever since the epidemic started. We only had 19 cases in 2019. So easy for me to remember. And we were like, oh my gosh, PrEP is doing its job. It must have there's been a wave of it or something. People are on it. We're doing so good. This is amazing. And then 2020 hit. And even though we thought, well, people probably aren't going to be seeking as much care because of COVID and everyone's locked up in their homes, our numbers were still higher, even with that added, we thought, well, actually, no, now less people tested, but more people tested positive. And then it's been on a little bit of an uptrend since. We hit 42 cases in 2022, and we hadn't had that high of a number since 2011. And then we're not at that high rate in these last 2 years, but we're still in the upper 30s, which is, somewhere we don't want to be.
No, absolutely. Yeah. Which is why we're raising awareness.
Yes,
right?
Exactly.
Yeah.
And the other thing is that many people know that gay and bisexual men are at risk for HIV, and because of that, even the doctors are more likely to regularly test them. But we've been seeing higher trends in people who might identify as heterosexual, especially people in the Latinx community. We've been seeing more people identifying as Latinx being diagnosed with HIV. And so because the trends are changing, I think it's harder for even the providers to be catching up and knowing what they should be doing. So that's why we're also bringing it to people so that they can take part in their own health.
Yeah. Well, I wanted to let our listeners know that the Sonoma County Public Health Division has a website with HIV AIDS resources. It's on the county's website, sonomacounty.ca.gov, and then you can navigate to the Health Services Public Health Disease Control page and look for the HIV AIDS resources. Is that right?
Yeah. We also made it a short link so that it's Sonoma County. Oh my goodness. It's just the main one and then /HIV.
Good. SonomaCounty.ca.gov/HIV.
Thank you. Yes.
That's it, right?
That's
Great.
it.
Well, Miranda, thank you so much for being here today. I
Thank you
really
so much for
appreciate
having
that.
me.
Yeah, absolutely. And, as a thank you for being our guest, we'd like to present you with one of our SoCo Chat coffee mugs.
Oh, thank you.
You're welcome. And to our listeners, we would also like to give you a chance to win one of our SoCo Chat mugs. Just answer our trivia question, and you'll be entered into our weekly drawing. As a reminder, our question today is, what is the name of the 1993 HBO movie about the origins of the AIDS epidemic that starred Matthew Modine, Alan Alda, and Richard Gere? If you know the answer, call us at 707-565-2242 or email us at publicaffairs@sonoma-county.org. Submit your answer to us soon for your chance to win this prize. Also, if you have comments about this or other segments or suggestions for a topic for a future SoCo Chat discussion, please email us at that same address, publicaffairs@sonoma-county.org. Thank you all, and we hope you continue to follow SoCo Chat on Spotify, Apple Music, Amazon, and of course, YouTube. See you next time.